Greetings from Manipal Academy of Higher Education and Institute of Eminence. I'm Dr. Geeta Maya, Director Student Affairs. On behalf of Manipal Academy of Higher Education, I extend heartfelt gratitude to all the members of IMC Ramakrishna Bajaj National Quality Award Trust. We appreciate the invaluable opportunity provided to us to showcase our initiative, Drug Free Community or Nasha Muktu Udupi Abhiyan by involving young leaders of MAHE in combating the scourge of drugs in Udupi district. The Department of Student Affairs MAHE offers holistic learning environment to all the students of MAHE by providing necessary support system during their study. This is my flow of presentation. As you all know, the problem of substance abuse is a global menace and is spread everywhere in the world. The Ministry of Social Justice and Empowerment implemented a scheme, Nasha Mukt Bharat Abhiyan. As part of this particular scheme, 272 districts were identified with a high percentage of drug users. It is disheartening to know that Udupi district is one among them. In a proactive measure, MAHE has initiated the project Nasha Mukt Udupi Abhiyan to curb this menace before it aggravates. The main objective of this Abhiyan are to conduct awareness programs on the repercussions of substance abuse for the youth and students, teachers at various schools and colleges in and around Udupi, and to create awareness and sensitize people living in villages in and around Udupi to the problems resulting from drug use. As a development stage, the project NMUA, funded by the Ministry of Social Justice and Empowerment, commenced with the formation of a core committee, a patent committee involving MAHE leaders to garner advice and support, and an expert committee involving in-house experts for valuable input, aiding in the formulation of programs to train selected staff and students. Eminent resource persons facilitated training sessions to train the selected staff and students of MAHE. The preliminary discussions were held with the panchayat heads and community leaders. Anganwadi and Asha workers were also trained to seek their support. A survey was carried out to obtain insight into drug abuse patterns at 20 villages to identify 10 hotspot villages in Udupi district. As a deployment step of the project, a door-to-door visit to give awareness talk and distribution of handbills prepared by the team NMUA were carried out by trained students. As an education initiative, webinars and online talk series, awareness programs for staff, students, including housekeeping and caretakers of all MAHE hostels, and several competitions to develop ideas and skills in the fight against substance use were organized. Further, medical, dental, and dementia screening camps, dance, music, street plays, mime, and wall painting for students of schools and colleges. An awareness program for the inmates of a de-addiction camp was also conducted. Workshop on youth against drugs, mental health is a universal human right, and activities in various mass gathering places such as the Malpe Fish Market of Udupi districts were conducted as part of the project. We have also organized a marathon on the theme Mental Health is a Universal Human Right on November 10, 2023 at MAHE Manipal campus. And also a walkathon on the theme Nashe Se Azadi on August 4, 2022 at Manuru High School, Kota. Around 18,000 newly joined students of various institutions of MAHE are briefed about the ill effects of substance use during their orientation program. The NMUA project has yielded disruptive results showcasing its impactful outcomes. Over 150 students showing early signs of substance abuse were identified and transformed with the assistance of MAHE student counselors. A remarkable outreach of over 50,000 people has been achieved over 2 years. A release offered special postal cover to commemorate the Abhiyan, 4 newsletters encompassing all project activities, active engagement on social media platforms, and the project's achievements in local newspaper contributing to its recognition and impact on the community. As part of the project, Nasha Mukt and peer support clubs were launched at various institutions of MAHE. The project's success led to the deployment of a 6-credit life skills course, which will be made mandatory for all first-year students at MAHE. An anonymous reporting system was instituted to facilitate peer support, allowing students to help their peers discreetly. Constant communication with caretakers, housekeeping staff, and frequent meetings with student council members of various institutions enhanced support systems. The team was invited to participate in a program chaired by the Union Minister of Social Justice and Empowerment, alongside other universities recognized for their excellence in conducting awareness programs.
माननीय मंत्री जी, युवाओं में बढ़ रहे मादक पदार्थों के सेवन और उसके परिणाम की जानकारी ने मुझे नशा मुक्त भारत अभियान में भागीदार होने के लिए प्रेरित किया और इस अभियान के साथ मेरा सफर डिपार्टमेंट ऑफ स्टूडेंट अफेयर्स माहे के अंतर्गत प्रारंभ हुआ। डॉक्टर गीता मैया जी, जो माहे में इस अभियान का प्रतिनिधित्व कर रही हैं, उनके मार्गदर्शन में हमने उडुपी को नशा मुक्त बनाने के लिए कई सारे कदम उठाए। पिछले वर्ष हम सभी युवा प्रतिनिधियों को पीयर सपोर्ट वर्कशॉप्स के द्वारा नशे की लत से जूझ रहे विद्यार्थियों के आइडेंटिफिकेशन और काउंसलिंग के लिए प्रशिक्षित किया गया। इस वर्ष भी हमने करीब 20 गाँव में फ्लायर वितरण का कार्य किया, जिसके दौरान हमने वहाँ रह रहे निःशुल्क काउंसलिंग जैसी सुविधाओं के बारे में अवगत कराया। इसके अलावा हमने उडुपी और आसपास के गाँवों में गाँव के शैक्षणिक केंद्रों में नशा के विरुद्ध बड़े ही रचनात्मक तरीके से जागरूकता फैलाने का प्रयास किया। संगीत, नृत्य, मेडिकल कैंप्स और नाटक के साथ साथ युवाओं का ध्यान खेल और ध्यान की तरफ आकर्षित करने के लिए हमने भव्य कार्यक्रम जैसे कि मणिपाल फाइट नाइट, जो कि एक बॉक्सिंग प्रतियोगिता थी, का भी आयोजन किया। इस अभियान के अंतर्गत हमने माहे के प्रत्येक कॉलेज में नशा मुक्त क्लब का उद्घाटन किया है। इन क्लब्स के माध्यम से हम सब युवा प्रतिनिधि अधिक से अधिक विद्यार्थियों को नशा मुक्त भारत अभियान का हिस्सा बनाने के प्रयास। विश्वविद्यालय के मार्गदर्शन में हम समय समय पर इन क्लब्स में ग्रुप डिस्कशंस एवं अन्य प्रतियोगिताओं का आयोजन करते हैं। माननीय मंत्री जी, इस अभियान में भागीदारी मात्र ने न सिर्फ मेरे भीतर देशभक्ति की भावना को सशक्त किया है, अपितु भविष्य में मुझे समाज कल्याण के लिए कार्य करने के लिए भी प्रेरित किया है। माननीय मंत्री जी, मैं उडुपी की टीम की तरफ से आपको और मंत्रालय को आप सभी के निरंतर मार्गदर्शन और सहयोग के लिए आभार प्रकट करती हूँ और उम्मीद करती हूँ कि आज़ादी के इस अमृत काल में नशा मुक्त भारत अभियान के प्रयासों को पूरे देश में सफलता मिलेगी। जय हिंद।
Positive feedback from students involved in the project underscores its success. Regular feedback from the participants during the Abhiyan, feedback on the student well-being, formation of peer support, the Nasha Mukt clubs, anonymous reporting system, frequent meetings with student council members, regular meetings with hostel wardens, caretakers, housekeeping staff by MAHE student councillors serve as an additional monitoring system. These initiatives, along with existing support system, are considered best practices for early identification of at-risk students. Why is it a best practice? The NMA team worked on the concept of 4T techniques: track, talk, treat, and transform, and achieved promising results in identifying at-risk students due to the formation of peer support, Nasha Mukt clubs, and an anonymous peers reporting system, as well as frequent meetings with housekeeping staff, caretakers, and student council members. The concerns of the identified students are addressed by MAHE student councillor, and if required, they are referred to the clinical psychology or psychiatry department of Kasturba Hospital, Manipal. And with regular follow-ups, students are transformed. Collaboration with the Ministry of Social Justice and Empowerment, Udupi District Administration, Justice Board, NGOs and community-based organization facilitated the effective implementation of the project, and they assured of continuous support for future engagement with community. And the introduction of life skills course will help our students to be away from all the problems, or what are the coping techniques they are supposed to use in case of any challenge if they are facing. In summary, as part of the project, we conducted several awareness programs, competitions to the students of MAHE as well as residents of Udupi district to achieve promising results. The speciality of this project is all activities were executed by students, highlighting the leadership and commitment of young leaders at MAHE. Thank you.